Triple M, hi, how you going? It's Cliff on the drive home. For the last couple of years, we've teamed up with the Cancer Council to make sure that the message, find cancer early, gets into you, because this can literally save your life. And it's good to have back with us once again Cassandra Clayforth. Cassandra is the Regional Education Manager at Cancer Council WA, and she basically oversees the Find Cancer Early program for regional WA folk like you and I. Find Cancer Early is all about increasing symptom awareness in regional Western Australia and basically prompting people to say, hey, I think I might go to the doctor and get this checked out. Find cancer early. Cassandra Clayforth, hello, welcome back. I hope you're well.
I am well, and thank you for having me again.
Pleasure. You basically deliver this Find Cancer Early campaign. Have I wrapped it up there well enough in the introduction, or is there more to it?
Yeah, it's a very good introduction. There is a little bit more to it. Essentially, it is about helping regional people in WA, and we are focusing on people over the age of 40, and just, making them aware of the common cancer symptoms, and, as you said, really motivating them to visit a doctor, clinic nurse or Aboriginal health worker earlier if they have any symptoms. And it's probably worth flagging that we have actually run 2 ads in previous years. So viewers may recall an ad with rural doctors in the bathroom talking about symptoms. And I think, Cliff, we've had a couple of chats about that ad over the years.
Yep.
And our most recent ad is actually, it's got real people from the regions who have had cancer or lost loved ones to cancer. And they're just talking about symptoms and advising people to not make excuses when you live out here. Essentially those ads are on TV, but we have similar ads on radio, newspapers, social media, and in shopping centres and some licensed venues as well.
It's just basically drumming that message in. I know you've got a bit of a focus on lung cancer. Why did you develop this campaign? Was there a specific lot of research that you saw and went, oh, hang on, we've got to do something about this?
Yeah, so there is data to say that sadly people living in regional Australia have lower rates of 5-year survival for all cancers combined when you compare them to people living in metropolitan areas. And essentially, we want to change that.
Why is that the regional folks seem to have not so good an outcome in some instances?
Yeah, so there has been research done in Western Australia a couple of years ago that shows people who live in the regions here report symptoms to their doctor a little bit later, and so their diagnoses are delayed. And this is concerning because if cancer is found in the early stages, it can often be easily removed or treated. When cancer is found later, it usually has a chance to spread. Treatment becomes more difficult, and the person's chances of survival may not be as good.
Now, I've got a rough idea why regional folk, especially in smaller country towns, would be delaying looking for help. But you're the star, you're the educator. What have you found out? What reasons do people give to say, oh no, I didn't go because?
Yeah, so the same research indicated travel, which, as you can imagine, it would be a big barrier. So people were saying that they delayed making appointments until there were several reasons to visit another town. But there were also people saying that they thought their symptoms were due to other reasons. So, for example, people said they thought their urinary symptoms could be due to ageing, or fatigue due to a heavier workload than usual, weight loss due to dietary changes, and then one of the ones that came up was rectal bleeding they thought could be due to piles or hemorrhoids. So essentially, sadly, they didn't realise that all their symptoms were actually symptoms of cancer. And some people even said that they were self-managing their symptoms. So, for example, one participant had developed severe diarrhoea and wore incontinence pads for many weeks before seeing a doctor. So essentially, while we understand there are many reasons why people in regional WA might hesitate to see a doctor, we really urge regional people to book an appointment straight away when they notice symptoms.
I just want to come back to something. You mentioned that this campaign is for people over 40. Why specifically that group?
Yeah, so we promote the campaign and its messages to people over 40 because the chance of developing cancer actually increases as you age, and specifically after the age of 40. So we don't actively promote it to people under 40 because we don't want to cause unnecessary anxiety in people who are not likely to develop cancer.
Cassandra Clayforth is with us for our special again this year. Cassandra is the Regional Education Manager for Cancer Council WA. And of course, the message is find cancer early. So let's go to some specifics here, Cassandra. If you do notice a symptom, can you not just participate in one of those national screening programs? Because I know the breast screening program is there, a bowel screening program is there too. Is that, I mean, it's good to be in those, I suppose, but that, if you've got symptoms, that's not going to really help you, is it?
Yeah, so those population cancer screening programs that you've mentioned, so breast screen, the bowel cancer screening kits, they're all really excellent at detecting early cancer in people who do not have symptoms. So, if you don't have symptoms, then yes, we encourage you to participate in those programs if eligible. However, if you do have a symptom, we really urge people to see the doctor instead, as participating in a screening program can actually delay your diagnosis and lead to a worse outcome.
There's lots of types of cancers, I guess. I don't know if you want to run through some of those, but I want to ask, have there been improvements in survival rates?
Yeah, absolutely. So most people are quite surprised to hear that there are more than 200 different types of cancers. And thanks to research, amazing progress has been made over the last 30 years. So when we look at cancer survival in Australia, it has increased from about 51% in 1987 to 1991, and it's gone up to 69% in 2012 to 2016, yeah. So, and, for some of those common cancers, if found early, survival is as high as 80 to 98%.
Find cancer early, that's the message.
That's right.
Find it early.
That's right. Yeah, so generally speaking, the earlier cancer is found, the more treatment options available and the better chance of successful treatment and survival.
I guess in a lot of ways it's going to be Perth that you've got to go to for treatment, but is there somewhere that people can stay if they're in that situation?
Yeah, absolutely. So Cancer Council WA has self-catering accommodation lodges in Perth that are really there for regional cancer patients and their carers. So they can stay there while they access treatments or have their appointments in Perth. If people live 100 kilometres or more from the city or based in Northern or York, they also may be eligible for the government's Patient Assisted Travel Scheme, or PAT. And if they are eligible, they may not have to incur any costs other than personal telephone charges. So it's very cheap. Yeah, it's very, very cheap. And it's worth just flagging that these lodges have a range of social distancing and hygiene protocols, including mask wearing due to the current COVID-19 situation. And guests, must be up to date with their COVID-19 vaccinations as well.
Okay, so where do you want to point us if we want to find some more information?
Yeah, so people can go to findcancerearly.com.au or call 13 11 20.
13 11 20. I've got that written down there now. Now, in the next hour, we're going to be talking to a lung cancer champion. We've got a GP coming up, also a respiratory physician. Why the focus on lung cancer for this year?
Yeah, so we're focusing on lung cancer because we did receive some data recently from the WA Cancer Registry that showed an improvement in lung cancer survival after 5 years in people living in Perth, but not much of an improvement in people living in the region. So we really need regional people to be aware of possible lung cancer symptoms and go to their doctor earlier. So that's why we're focusing on lung cancer in this show.
That's it. That's ahead of us. But for now, I'll give that number again, 13 11 20, or findcancerearly.com.au. Cassandra, you are a breath of fresh air. I'm glad that we are able to help you get that Find Cancer Early message out there. It's really nice to be able to talk to you once again. Thank you for your help. And we're going to take a bit of a break, but we've got some more people coming up. For now, thanks so much.
Thank you for having me again, Cliff.
You're with The Drive Home on Triple M. Triple M, it's Cliff, and this is The Drive Home. It's a special edition. Once a year, we team up with the Cancer Council to say, find cancer early. It might save your life, Might not be much fun along the way, but if you do something early, it could just save your life. And here's a bloke who is a champion of the Find Cancer Early message. He's a Toodyay farmer, good fella, in his 70s now, and we're lucky that he's still here. Terry Keane. Hello, my friend. Can I ask you first off, how are you today?
I'm all right, thank you.
That's good. Let's go back a way, shall we? We have got the message, Find Cancer Early. We're specifically talking this time about lung cancer. Give me the time frame, Terry, from when you first thought that there might be a problem to where we are now.
Oh, a bit over 4 years.
Okay. And what did you notice? What sort of changes drove you off to the doctor?
Well, they give me blood pressure tablets, and I got a pain in my left lung. So I went back to the doctor, and they changed the tablets a couple of times and give me AKG, and then I forgot about it for a while, but I still had it. It was only a little tingle. And I went back for my scripts to go away, and she said to me, "You still got that pain in your chest?" And I said, "Yes." And she said, "Okay, CAT scan." And I had a CAT scan, and it come up with a tumour in my left lung.
It was about 30 millimetres, I believe, Terry.
Yes, it was a 30-millimetre tumour, up the top of my left lung.
I asked this question of one of our champions last year, and if I may, I'll ask you as well. What is it like when the doctor sitting across the desk from you says, "I'm sorry, Terry, it's cancer"?
Well, I've smoked for 50 years, so I reckon I deserved it.
You did not deserve it. It didn't help you along the way, but nobody deserves cancer.
But she was more worried. She was nearly bursting in tears when she had to tell me that I had it. But I accepted it, and we just went from there.
Did you have a cough? Was there a tickle? Was there blood? Was there anything like that at all?
No, nothing. Just a little ache.
And then
just a little ache.
You go off to the doctor. What was the advice then? And how quickly did you get the diagnosis? Was it just snap straight away?
Well, after the blood test and all that we done, blood pressure tablets, once it was diagnosed, I went virtually straight into hospital.
And the treatment?
I had 2 biopsies down Midland, and then they sent me over to Charlie's.
Chemo, radiation, all that?
Yeah. 6 weeks of both.
They tell me it knocks you flat.
No, not necessarily. I was all right until the first 5 weeks. I was good. But then the last week on the way home, that was it. Yeah.
Well, at least you're here now, which is good. Oh, I must ask you too. You stayed in Perth. What was the Cancer Council WA's accommodation lodge like? Was that nice?
Milroy Lodge was tops. I reckon it was 110%. Everybody in there helped everybody, and we all got along. And the service to the hospital was great. So take you over in a little van and pick you up in a little van, and everything was good there.
Yeah. Now, this is one of the most important things. What advice are you going to give as the Find Cancer Early champion to someone now who might be thinking, "Oh, gee, I did have that little thing there," or "I've had a cough that won't go away, I've got a pain," or whatever? What advice are you going to give?
Well, like I said, I had a little pain in the top of my chest, and I was 68 years old, and I was ready to go halfway around Australia. And if I didn't go back to the doctor to get me scripts to do that trip, they wouldn't have found it. And if I'd have gone, I reckon I would have been in a hell of a lot of trouble.
You might not have been here, Because
that could be so.
Yeah, that's the message. Find cancer early, or the consequences could be dire. I'm very glad that you're here. Are you like a lot of Australian blokes? Because, Terry, I'll admit I am. I've just about got to be in the box before I'll go off to the doctor. Was that you as well?
Yeah, in them days, yes.
Yeah.
In them days, yes, I was.
We know better now, don't we?
Oh, yeah.
Most
we
certainly.
certainly do.
Get thee to the doctor and quick. Any other advice just in closing here, Terry?
No, that's it. As far as cancer is concerned, don't muck around.
Yeah.
Well, as far as anything's concerned, don't muck around.
Don't be embarrassed to go to the doctor. They've seen and heard it all before, and it might just save your life.
Well, it could.
Excellent.
There's other things you've got to worry about too, like hearts and all that stuff too. So if you get any aches and pains or something, go to the doctor.
Yep. They're not going to bite you, are they?
Oh, I don't know about
that. Great to have you with us as our champion of the Find Cancer Early message. Terry, may you live a long and happy life, and I hope you get the second half of that trip around Australia one day.
I will now that the borders are open. Thank you very much.
Good on you.
Talking with me.
Take care, pal. Nice to talk to you. Terry Keane is in Toodyay, a champion of the Find Cancer Early message. Lung cancer, you don't mess around with that. You don't mess around with any of this sort of stuff. And there's more to come here on Triple M. Good to have you with us. It's Cliff on Triple M, and a special edition today for the drive home. And we've done this for the last couple of years, teaming up with Find Cancer Early, the WA Cancer Council. And the message, Find Cancer Early, is obviously about increasing symptom awareness in regional WA especially, and making sure that you seek medical advice early if you've got any symptoms. And Dr. Max Kamien is back with us again for this year. It's good to have him. His current occupation, he is the Emeritus Professor of General Practice at UWA and one of the GPs who starred in the first Find Cancer Early TV advertisements. You would have seen him. He's back with us on the phone. Dr. Max Kamien, good afternoon, and thank you for your help again. I hope you're well, sir.
Good afternoon, Cliff. It's always good to speak to you, and for an old bloke, I'm quite well.
That is good news. Last year when you were here, the message, Find Cancer Early, the follow-up when I was talking to the Cancer Council people, they believed that there was an increase in people going off to see their doctor just as an in case. We've got a bit of a focus this time on lung cancer, but let me ask you, how often do GPs actually see cases of cancer?
I reckon that in a year, I would, excluding skin cancers, I would see or diagnose probably around about 10 to 15 people with a cancer.
So I figure there's a number of symptoms that people are coming to see a GP for. How do you know if it's a cancer symptom, or it could be something else that, you've got to go to the doctor, but it's not as bad?
Well, you don't know, but there are certain sort of red flags, say you're talking about lung cancer, somebody who says they're getting short of breath, or somebody who develops a new cough. Of course, anybody who coughs up some blood would be stupid not to go and see their doctor immediately. And people who get pain when they're taking a deep breath, or when they just feel uncomfortable in one part of their chest, and it persists. People who have those symptoms and also starting to lose a bit of weight, those are the sort of people who should go and see their doctor and be checked out.
And I guess especially for regional WA and for blokes, because sometimes we're not that good at looking after ourselves, you must have heard all the excuses under the sun why people don't go to the doctor. And what do you say to them?
Well, I say, look, it's not an adaptive system. I mean, in life, you've got to adapt to keep living. And when you just sort of deny that you've got something, or you say, oh, look, I'm too busy for that, or, next time we're in town, I'll go and see the doctor. That's not an adaptive system. And nowadays, there's all kinds of ways in which you can contact the doctor. You can contact by phone, you can contact by Zoom, by iChat. You can do all of those things. And doctors now are able to talk to you and get a fee for it. And and they will advise you. Your doctor will advise you as to what you should do and how soon you should do it, whether it can wait or whether it should be seen by the next day.
And I guess the thing is, and that's what this is all about, find cancer early, because it might just save your life. So is that the bottom line for you, Doc?
Absolutely.
Now, we've got COVID that's still around. Some people might be wondering, oh, gee, is it actually safe to travel and see someone? And I guess that, if they don't actually go to the doctor and see you face-to-face across the desk, that's what your Zoom calls and everything's all about, I guess.
Well, that's one thing. But the second thing is if the doctor says, listen, I think you better come and see me, the practice will give instructions as to what's expected, that you should probably turn up wearing a mask, that you shouldn't go into the practice itself until they tell you to. Hopefully, you've been immunised, you've got 2 or 3 injections against COVID, and when you check in with your iPhone or you check in some other way, the reception staff will tell you what to do and where to go. Some practices now have people sitting outside with 3 metres apart, but they'll tell you what to do.
And advice that you would give to someone who believes their system can wait because of COVID-19, it might blow away, comes back again, I guess, ask the question, go and see your doctor.
Well, yeah, I mean, COVID-19 hasn't changed the message, and COVID-19 hasn't resulted in a diminution of cancers. So it doesn't. That's something that doesn't make a difference to what you would normally do with cancers. It simply makes a difference as to how you would approach the practice.
Okay, so you've mentioned telephone, Zoom, telehealth. What sort of advice are you giving people before they go to one of those appointments?
Well, if you're worried or if you see something or if your other half is worried or someone says to you, hey, you've got this thing, you look a bit funny, and you decide that you should go to the doctor or you're being pushed to go, then don't hesitate, just go.
And I've left this one till last, Doctor. There's the embarrassment factor and maybe the yuck factor. What do you say?
Well, the doctor's not embarrassed because that's what the doctor does. I mean, I once did a colonoscopy on a Shire clerk, and I happened to be, and I did a pap smear on the Shire president's wife in a country town, and then I went to a Rotary Club dinner, and I happened to be sitting between the 2 of them, and they looked terribly embarrassed. And I sort of explained to the lady that, I wasn't embarrassed at all, that she didn't need to be embarrassed. It's just part of her anatomy. And I explained to the Shire clerk that, just because I'd done a colonoscopy on him, I didn't regard him as an asshole.
That is a great line. That's a good line. But it is hard in country towns, and smaller country towns, and you go, oh, God, the doctor's going to have to look up my bum or whatever. I've got to get a stool sample or something like that. But again, this might save your life.
Yes, it might. Yep. And being embarrassed is much better than dying young.
Absolutely. The message, find cancer early. Dr. Max Kamien, always nice to talk to you. I find it fascinating discussing this stuff with you. And the message is, find cancer early, and hopefully you'll be here to have our special again next year. Always nice. Have a good night tonight.
Thanks very much, Cliff.
Take
Bye.
care. Dr. Max Kamien, one of our special guests for Find Cancer Early, the special today for WA Cancer Council and the drive home on Triple M. Triple M on the drive home across WA. I hope you are well. It's Cliff, and once again this year we're teaming up with Cancer Council WA to put forward the message, find cancer early. It might save your life. Maybe there'll be some embarrassment along the way, but it might save your life. Professor Fraser Brims is with us. Professor Brims is the consultant respiratory physician at Sir Charles Gairdner Hospital in Perth. He's the Deputy Director of the Institute for Respiratory Health and chairs the West Australian Mesothelioma Registry. We've got a bit of a special on lung cancer this time around. Professor, thank you for being with us. I trust you are well.
I am, thank you. Good afternoon, Cliff.
Good to have you here, and thanks for your input. I had a chat with Dr. Kamien. He said in general practice, discounting skin cancers, probably about 10 to 15 times a year, a GP will see cancer. Mm-hmm. What about lung cancer? How often do we see that in WA?
Well, in WA, it's around about the fifth most common cancer in Australia. In 2018, about 1,100 West Australians were diagnosed with lung cancer, and sadly, of those, about 750 died in that same year as well. So it is, it's, as I say, the fifth most common, but actually the most common cause of cancer death, and that's why it's so important. We know now with lung cancer we can find it early, we can make a difference and try and change some of those figures.
Well, what are the most common symptoms to look out for?
So the most important ones are a new or changed symptoms, particularly of a cough, or just feeling more breathless, or funny pains in the chest and just feeling tired and worn out. But importantly, what we tend to say is, so if you've got more than 3 weeks of a cough that's changed, or one of those other symptoms, breathless, chest pains or fatigue, then you should go and get it checked out with your doctor and hopefully just get some reassurance.
And I suppose, and I've said this before, we blokes, we're not that good at looking after ourselves. Oh, that'll go away. Oh, it's just a cough. It's just a cold. Maybe, maybe I've got COVID. I don't know about that. Some of those symptoms that you mentioned there could be the symptoms of something that's not quite so bad. But is there a marked difference there's that?
I guess one of the main, one thing would be, something like COVID or any bronchitis or viral chest infection really should be better by 3 weeks. So again, if it's hanging around, or even if you have a cough most of the time and it's worse, so it's changed for more than 3 weeks, then that's what you should go and see your doc. But importantly, I guess coughing up blood is definitely something that we would want to know that you're seeing your GP about. It doesn't mean you've got cancer. There's many other reasons why it could be there. But again, the earlier we catch lung cancer, the better it can be. Things have really changed with how we can treat lung cancer now. And so it's really important we find out about it early.
Actually, I want to come back to those changes in treatment. But firstly, let me say, we're talking to all of the regional areas around Western Australia. Some people have immense distances that they've got to cover. So is there really that much of a worry of waiting, maybe 3 or 4 weeks, or, your next trip to town is going to be in 6 weeks' time? Much concern there for you?
Yeah, it is a bit, and I fully appreciate the challenges of the distance and the size of WA. But we do hear stories in clinic of people that have waited 3, even 6 months sometimes before seeing their doctor, and it's sad because sometimes you think, gosh, if only we'd found out about this a lot earlier, hopefully we could have really made a difference. So, yeah. And I think we certainly at Charles Gairdner and across all the major hospitals, we make a huge effort to support people in sort of regional, remote areas, and and try and get things done as quickly and efficiently, as we possibly can.
Is there a group that's more at risk of developing lung cancer? And I suppose secondary to that, are there ways of preventing lung cancer?
Yeah, so I think, the bottom line is that everybody could potentially get a lung cancer, but it's very rare below the age of 50 for a start. People with a family history, so someone within the family that's had lung cancer, and people that come across dust, things like asbestos in particular, but maybe silica as well, and of course smoking. But we know more and more it's not just about smoking. So 1 in 5 or so Australians now diagnosed with lung cancer have never smoked. And it's a bit more common in females as well. So it's not about the smoking anymore. Everybody's potentially at risk, and that's why, again, if you fall back to the simple thing, have those symptoms, cough, breathlessness, chest pains, fatigue for more than 3 weeks, then go and get some help.
What do you do to diagnose lung cancer?
Look, it's fairly simple in some ways. The doctor will have a chat and find out about what's been going on and some background. But often you'll end up having a chest X-ray or maybe a CT scan, and that often can be enough for a doctor to reassure you and say, hey, look, there's nothing here to worry about. If there is something there, then sometimes some simple blowing tests. And many occasions we look to get a sample of, if there's a bit of shadowing or a lump or something in the chest, we look to get a sample, which is a biopsy. And then we know for sure often what's going on.
And you mentioned there's been some changes in treatment there. Can you give us the Reader's Digest version of that?
Yeah, so lots of change. We know, as I say, if we find lung cancer early when it's small and before it's spread, then surgery these days is like keyhole surgery. It's very, very good. Chemotherapy's changed now, and in fact, it's your listeners may have heard of something called immunotherapy, but it's really a fancy way of getting the body's immune system to kill off the cancer for it. It's an amazing thing, and it's going to make a huge difference with lung cancer treatments. And even radiotherapi's changed enormously now. We can give really effective treatments with minimal side effects, and so a lot's changed. There's a lot to be optimistic about, or more optimistic about, with lung cancer these days.
And so, if I was to wave a magic wand, Professor, and say, righto, you can make some more changes in the lung cancer space, what would you like to see?
I think probably the most important thing is we as a community need to move away from being judgmental about lung cancer. There's a terrible stigma involved with it, and frankly, over years gone by, we've been very judgmental of people. We assume that all people with lung cancers have smoked, and we judge them by that. And it's simply not fair. So we need to stop asking the wrong question. We don't judge someone with melanoma for having sunbathed, or someone with colon cancer for having a bad diet. So we just have to get on and get over that one, and have sympathy for people with a really challenging, difficult condition. So that's the main thing: is move away from this bias and this judgment.
Just in closing here, as I say, we're talking to all of the regional areas around WA. What sort of supports are available at this point?
As soon as the GP flags up to us, be it across any of the sites, but obviously I work at Charles Gairdner, then we will see that they're from regional, rural, wherever, and we give it an extra effort to coordinate a trip down to Perth. We know it's a big thing, and we can help find travel and accommodation. We have specialist nurses who will arrange to get everything done, normally in a working week, or even less sometimes. And in fact, we did an audit last year of our practice, looking at different things, and we actually found that we were getting people diagnosed and treated from regional areas, rural areas, faster than people who live in the city with us, because we were concentrating on them so heavily. So we've now taken what we've been doing for rural, regional people, and doing it even more for our sort of more local metro people. So, I think we're offering a really good service, and most importantly, we know it's a challenge, we know it's hard, but we'll make it as easy as we can, for you at what we know is a difficult time.
Let me give you these contacts again. It's 13 11 20 on the phone, otherwise online, findcancerearly.com.au. And let me say again, and I'm sure the Professor would echo this, it might save your life. Find Cancer Early. Professor, lovely to talk to you. Thank you for being part of our special, and let's hope that people do, in fact, find cancer early. It might put you out of a job, but, if people are alive at the Christmas table this year, I think we'd both be pretty happy with that.
I'd be very happy not to be seeing people with lung cancer. That would be great, Cliff.
Lovely.
Yeah, thank you.
Take care, and thank you again for your participation in our special. Professor Fraser Brims, the number again, 13 11 20. Find Cancer Early on Triple M. Triple M, good to have you with us this afternoon. It's Cliff on the drive home. We spoke earlier today to Cassandra Clayforth, who's the Regional Education Manager for Cancer Council WA. And I've just got Cassandra back on the phone with us once again to wrap up our special for today. Very interesting information there for us again, Cassandra. Do you feel like the Cancer Council is winning the war, that people are taking these messages on more and more and more? You talked before about the survival rate, so I guess people are getting it.
Yeah, survival rates are improving. We do also, funnily enough, evaluate our campaigns after we air them. So we've had some increases in awareness in the last couple of years, which is great as well. So, so hopefully, but we still got to keep repeating the message, because there is just those few people that haven't heard it or still need a bit of a reminder.
Give us the rundown again. Cancer symptoms to keep an eye out for.
Yeah, so blood in your poo or in your pee, or if you've coughed up blood, then even if it's just once, please see your doctor. Or if you've noticed for more than 4 weeks, a few symptoms that I'm going to talk you through. So problems peeing, unexplained weight loss, a persistent cough, shortness of breath, an unusual pain, lump or swelling anywhere in your body, a new or changed spot on your skin, or changes to your bowel habits. So that could be runny poo, pooing more often, or constipation. If you've noticed any of those, please see your doctor, or anything that's unusual for you. It doesn't mean you've got cancer. Often it's something less serious, but it's important to get checked out by a medical professional just in case.
Yeah, and as the doctor said earlier, it could be the big one, but it might very well be something else. But you've got to know. You have to find it early. What's the best contact points for more information, Cassandra?
Yeah, so once again, findcancerearly.com.au, or you can call 13 11 20.
There you go. Thank you for allowing me to help you get that message out there. Stay well, and we will talk again soon. Thank you so much.
Thank you again, Cliff.
Take care. Cassandra Clayforth. Cassandra is the Regional Education Manager for Cancer Council WA, and it's nice to be able to help get the message all around Western Australia. Once again, that number 13 11 20, findcancerearly.com.au, and let me put my bit in there because it might save your life. It's The Drive Home on Triple M.